Hi everyone, it's Dr. Ellen here today at Reflections. I'm a cosmetic physician, and today we're talking about what the difference is between different Fraxel products. So Fraxel has Clear and Brilliant, it has Fraxel Restore Duel, and we have Fraxel Repair. So I'm going to go each one and we're going to talk about what the indications for that treatment is, downtime, that kind of stuff, how many treatments we need, so you get an idea and see which one kind of works for you. And if you have specific questions, we can do an in-person consultation. So let's begin. Clear and Brilliant. So Clear and Brilliant is a type of laser that we use for lighter issues. It's a lighter version of the Fraxel Duel, basically. It has two different handpieces. We have the Ramea, which is primarily for pigments, and we have the 1440 handpiece, which was the original one, that has a little deeper indications, more fine lines, pore size, and you get a little bit of textural irregularities. It is something we numb for about 30 minutes prior. Treatment itself is about 10 minutes long. It is done as a series because this is a very light laser, so we want to do multiple treatments to get enough injury cascade so that we have enough improvement in your texture, your pigment, whatever we're trying to aim for. With that particular laser, you have to kind of pick between texture and pigment, because we put one handpiece on for the entirety of the treatment. We use that for younger patients with melasma, patients that don't have a ton of issues that we're trying to deal with. It is actually probably one of our most popular lasers because of the fact that the downtime is basically for the rest of the day and that's it. But the next day you're looking pretty much back to normal. Skin's gonna feel a little bit dry, but you're able to kind of go about your life without too much disruption whatsoever. Treatments are spaced a month apart and best to be done, in the fall, like this time of year when the sun's down and you're not laying in the sun regularly. So that's Clear and Brilliant. Next one is Fraxel Duel. So Fraxel Duel is a more intense version of what we're talking about. So that also has two different settings, the 1927 and the 1550. The 1927 settings on the Fraxel are something that targets more pigment, more surface issues of that sort. You will get some textural irregularities or pore size improvements with the Fraxel 1927 as well, but lots of pigment reduction. In terms of trying to aim specifically for pigment, we'd say 2 treatments on average. You may need more or less depending on what issues you have going on, but I would aim for usually around 2 treatments to start. The other settings, the 1550, is more for deeper issues, pores, scarring, deeper fine line kind of issues. With this particular laser, you can mix and match. So you can either do an entire treatment that is 1927, an entire treatment that is 1550, or you can split the treatment in half and do half of the treatment with one and half of the treatment with the other. So we do a customized approach depending on what you're trying to accomplish so that you can get the results that you want. We numb for usually around an hour prior to the treatment. The treatment itself is about the same 15 minutes long. And then redness wise, you're going to be red for usually about 3 to 5 days afterwards. Initially it's going to look like a sunburn, you're going to get a bronzed appearance to your skin, and then depending on the settings and the laser, we're going to have some flaking, sometimes around the hairline, that sort of thing. So not a bad treatment whatsoever. Most people just look like they got sunburns. You're not going to be open, weeping, crusted, anything like that. You are going to feel dry, like I said, a little bit flaky sometimes. That's the most of it. This is also done as a series, so just depending on what our goals are, we may need more or less treatments. So we usually discuss on an individual basis as to how many of those you need. So that is Fraxel Restore Duel. The next one we're talking about is Fraxel Repair. So Fraxel Repair is a CO2 laser. This is a much more intense laser than the other two. Okay, so when we're talking about using a more intense laser, we need to be addressing kind of different factors that go into this. You need more numbing with this. A lot of times we end up injection numbing, especially if we're doing a smaller area. We need to be very cognizant because this is going to be a lot more uncomfortable if we don't numb more aggressively. You are going to have a sunburn-like appearance. This downtime can be 7 days up to 10 days depending on the person. There can be some weeping or crusting, and you are going to be pink for a while afterwards because we're making a lot of injury and we're creating a lot of new collagen building and a lot of fresh baby skin is going to be growing in. So a little more downtime wise. This laser is for people who have much deeper issues. So we do this sometimes just treatments over specific areas like scars, or if you have very fine lines that are etched very deeply in under the eyes or around the mouth. It's usually a one-time treatment. Some areas, like I said, around the mouth, that sometimes takes more than one because those lines are very hard to get rid of. So primarily it's a one-time treatment. It does have some reduction in brown spots as well when we're going over this, and it will have a little bit of tightening effect. So it's a really great laser. We use it in that particular sort of way. So when we're deciding who's getting what, I think it's best to have an in-person consultation we can decide the risk benefits and go over what you particularly have going on. We can talk about costs and things like that, and come up with a plan and, you know, come up with a specialized situation to address all your needs and make sure that these lasers are right for you. If they are not, we have many other lasers we use here at Reflections. So we look forward to seeing you in person, so have a great afternoon.